name is Senator Karen Keiser, Chair of the Senate Health and Long-Term Care Committee, and I want to thank my colleagues here at the table to joining us today, because today we are all signed on and filing an amicus brief to the United States Supreme Court. It is being filed in support of the Affordable Care Act, and this brief has been signed on to by nearly 500 legislators from all 50 states. And the legislators here have joined their colleagues in the Washington State legislature to add their voice to this case. State legislators agree with the ruling of lower court judges that were appointed by George W. Bush and Ronald Reagan, in fact, that the Affordable Care Act is constitutional. As you may recall, Chair Eileen Cody and I respectfully requested Attorney General Rob McKenna to not participate in this litigation that challenges the constitutionality of the Affordable Care Act. We were disappointed when he pursued his challenge despite our request, and in our opinion, wasted precious resources on the effort. Now, why do we feel that the Affordable Care Act is so important to be upheld? As legislators, we are on the front line of the healthcare crisis and on the job to implement this law. This week, Senate Bill 6178 and House Bill 2319 have been introduced at the governor's request to fully implement the Washington Health Exchange, and we will be taking action in both of our committees next week in the legislature. We cannot delay, we cannot wait, because the law requires that the state open enrollment through this exchange in the fall of 2013. It is already 2012. The Affordable Care Act has already helped our state and our citizens in many ways.
I think that it's important for us to note that one of the main reasons why it's so important to support the ACA is that 1 million young adults across the country have gained health insurance thanks to the new rule that enables young adults up to age 26 to be covered through a patient's private health insurance plan. And just this week, after the insurance commissioner had released his report on coverage in Washington state, he was able to tell us that the number of uninsured in that age bracket has dropped from where we have had. That's the only area where we have actually shown progress in insuring individuals, where we actually have more uninsured across the state because of the economy, except in that one area. So I think that that alone just shows that how it has helped us in Washington state. We also have insurance companies are now prohibited from denying coverage to the 372,000 children in Washington that have pre-existing conditions. An estimated 25,900 young adults in Washington will gain coverage because of the Affordable Care Act, letting them be on to help their parents' plan until their 26th birthday. 4.1 million Washingtonians with private insurance are free from worrying about lifetime limits on coverage. And we have also in Washington state received over $100 million in new grant funding to help establish a state health information exchange and providing a critical investment in community health centers. And yesterday in one of my healthcare committee in the House, we had a hearing on the exchange and heard from one of the new board members from the exchange that how important it is to move forward and that they're all working together. So the message is that Washington State is going to go forward and that we're happy to keep moving that direction.
Keep in mind, part of the Affordable Care Act addresses insurance companies and their ability to increase premiums. There is a cap under that act which insurance companies cannot go beyond of 10%. It's already been used in Oregon, Connecticut, North Carolina, and California to address insurance premiums that have gone beyond that 10% level. We had a great report issued only this week, I think it was an op-ed in the newspaper about the surpluses that these large insurance companies are amassing and the need to allow the insurance commissioners to have more authority in looking at those surpluses and setting these premiums. This is about affordable health care. And I just find it a little bit amazing that we're here again questioning the need for that kind of a law that helps our consumers.
Those of us in the state legislature, I think, need to continue our work to meet this growing healthcare need and do it with confidence, knowing that our implementation efforts aren't going to be delayed or derailed by some really groundless constitutional challenges that relate, I think, a lot more to political and partisan bickering than they do to the Constitution. In Washington State, we have thousands of citizens who live here, but who work in Oregon and Idaho, so this issue crosses borders, and the need for high-quality, affordable health care transcends any state borders. When actually, before I even, when I was considering running for the legislature, my 9-year-old son urged me to run, and when I asked him why, he told me, "I think you should talk about health care, Mom." And I think that, and I asked him why, and he said, because I see a lot of people out in the world who are really, really worried, and I think they're worried about losing their health care or not having health care. If a 9-year-old kid can see that, anybody in this state and everybody in this state can see that. The uninsured and the vulnerable in our country can't afford this balkanization of health care, and that's what's at stake in this case. So I'm glad that that we've got the leadership that we have for this 2012 legislative session, and hope we'll all continue to push for full implementation of the Affordable Care Act.